So I don't think you guys remember, but I'm a pharmacy technician. I've worked there at Walgreens for about 3 years now. So just to recall, my first year, I was actually subpoenaed to court 3 times. So alone in that first year, it's kind of scary when you first start off, you don't know what to expect. But all these cases that I was subpoenaed for, they all involve prescription forgery and possession of illicit substance. However, as a witness, the most scary thing about it is, or surprising actually, is that all the defendants were previously charged with the same cases or similar cases prior to my situations. So today I will be talking about prescription medication abuse. In the United States, prescription drug abuse has become an epidemic. The Substance Abuse and Mental Health Services Administration reported that in 2012, the amount of individuals abusing prescription medication has risen to about 7 million, which is 10% more than from what it was the previous year in 2011. This is definitely not a new problem. It's actually something that's been in our society for a very long time, but I guess we just disregarded it. So 3 main reasons to have some concern about this is that prescription medications can be seriously harmful to the body. Secondly, prescription drugs can lead to other risky behaviors such as violence. And thirdly, and last, they also have a high relapse rate. So to begin, actually I'll give you some background information about prescription drugs. According to the National Institute of Drug Abuse, prescription drug abuse is defined as taking a medication in a different way than it was prescribed. So an individual could be taking too much of the medication. They could be taking a medication that's written for someone else. You could be taking it through a different route via snorting or injection. And an individual could be taking the medication just because they want to get high or just attain euphoria. So in the United States, we have the best medical technology. So from the NCADD, there are 3 types of commonly abused drugs. We have opioids, central nervous system depressants, and stimulants. Opioids are used to treat pain. Central nervous system depressants are used to treat anxiety. And stimulants are generally used to treat for ADHD, so like attention deficit disorder, if you can't focus really well. In the category of opioids, the 2 common abused drugs are Oxycontin and Vicodin, and then CNS depressants are Xanax and Valium, and stimulants is, of course, Adderall and Ritalin. Okay. So although these drugs have good intentions to treat any disorders or like diseases or anything, misuse can result in potentially serious health risks. As we all know, long-term misuse of these drugs can lead to dependence and addiction. There is a clear distinction between the two. An individual can be dependent on it, and then an individual could just be addicted, meaning they're using it too much and they're using it out of their way. They need to have it. Not only that, each type of drug can harm the body and the mind. Opioids can severely damage your respiratory system, and they can block pain messages from the body to the spine. CNS depressants can cause amnesia, reduce reaction time, and you can have the loss of motor coordination. And then stimulants, they can cause psychosis, cardiovascular problems, and of course, all these drugs can lead to death, and that is caused by an overdose, so taking too many of the pills at one time, or like taking more than the suggested amount that your body can metabolize. So the CDC reported that prescription drug overdose mortality rates have increased significantly. So from 1999 to 2010, it has increased 102%. Additionally, the organization Trust for Americans Health reported that the leading death in 29 U.S. states was due to prescription drug abuse. This number is greater than motor vehicle accidents in all 29 of those states since 1999. Now they're aware of some of the potentially harmful health consequences, we should be advised that there are other risky behaviors when using prescription drugs. So many drug abusers often deny that a relation between drug use and violent behavior because they believe that their behavior is due to emotional factors rather than substance abuse. However, researchers at University of Michigan Injury Center conducted a research of 575 participants aged 14 to 24 years old over a 12-month period, and they found over those 1,300 incidents that all those individuals were using prescription drugs before their incidents in all 44% of the cases. So from the study, obviously we can infer that prescription drugs and violence, there is a strong correlation or maybe a strong connection between the two. So lastly, prescription drug use has a high relapse rate. The NIDA found that relapse rate for prescription drug addiction is between 40 and 60%. So what that means is basically when an individual gets off of prescription drugs and they're in rehab or they're sober for a certain amount of time, there's at least a 40 to 60% that they'll go back on the prescription drugs. And often, if not most cases, those relapse turns into death. So in addition to this statistic, when in comparison to other chronic diseases such as hypertension, which is high blood pressure, diabetes, or asthma, it's at the same level. With such high relapse rates, it's not surprising the amount of prescription drug abusers has increased so much in the past year, and the fatality rates are continuing to grow. As I stated before, prescription drug abuse in America is not a new problem. But with the recent surge of its users, it's certainly a problem that we should be more aware of because it can cause serious health risks, lead to bad behavior, and often with its abuse, it has a very high relapse rate. With an average of 2,000 teens misusing prescription drugs every day in the United States, it's imperative that we properly address this issue, not only because it will help us build a strong community, but it will also allow those that with substance abuse problems lead a healthier and more productive life.